So most of the time I was diagnosed with E. coli, so I would take the macrobid, that none of the antibiotics ended up helping. So the only thing that ended up helping, knock on wood. Well, I actually have a very basic question that you may scoff at, but for those of us who don't know what a UTI is, what is a UTI?
Well, it's an infection that occurs anywhere in the urinary tract. So the urinary tract includes the urethra, the bladder, the ureters, and the kidneys. Kidney infection is more serious and can come with different symptoms, which can include like a fever or chills or back pain or side pain. And some people actually get nausea and vomiting once it gets to that stage, whereas a lower urinary tract infection comes with more classic symptoms like blood in the urine, smelly urine, pain or burning while urinating. And even though those are the classic symptoms, we've heard from people that have such a diverse range of symptoms. So it's not like you can say, I don't have one of those four, therefore I don't have a UTI. Some people say they get pain radiating down their legs, or that they just have abdominal bloating or pressure feelings. And other people say they get pain in their foot, in one of their feet, or in one of their arms, or in their shoulder. So this referred pain can also be a symptom for some people. So you can't dismiss it if you don't fit the classic symptoms, if you think that you have a UTI. So it's always really important to see a doctor.
Yeah, it seems like there are so many different symptoms that it's like really hard to pinpoint. You need to see a doctor. What do people do if they don't have access to a doctor, whether, they can't afford it, or maybe the region that they're in, they just don't have access to a doctor? What do they do then?
I mean, that's a tricky question. It's not something I can really answer because it's always best to try to get help if you can. So if you can go to an emergency clinic or a hospital, that's still safer than not getting assessed. And of course, there's natural remedies that people take, but the efficacy of those can be questionable. And sometimes they're really shown to work for certain organisms and not others. And because you don't know what's causing the UTI, you're guessing basically. And even if you get help, you might be guessing, or the doctor might be guessing, but at least you'll be in a care environment. But I've been in that situation myself too, and I've had to do what I can and hope for the best. But it's always safer if you can get medical care.
Yeah, of course. So I often hear from my fellow ladies out there that they went to a doctor, they came in with, all of the famous UTI symptoms, and they were hoping to get help. And then they walked out even more, hopeless than when they first came in. And you have had a similar situation, Melissa, where you said that you didn't really find that the traditional treatment plans worked for you that often, doctors recommend. What helped you? And of course, you're not giving medical advice, you're just sharing your experience. What helped you with your UTI journey to finally kick those UTIs in the butt?
It was quite the journey. I had the recurrent UTI experience that a lot of people have, where you have a UTI, you get given antibiotics, it goes away and then it comes back. But over time, the symptoms got closer and closer together. And by the end of that 5-year period, there wasn't a day when I didn't have symptoms. And that's when I really had to take a step back and think about what else I could do. And the doctors that I was seeing were mostly just recommending the short courses of antibiotics. They did acknowledge that they didn't think it was going to be the answer, but they just didn't know what else they could do. And so because the antibiotics had started to give me side effects and yeast problems, and I was just like, my skin was itchy and I would sometimes have rashes. I basically felt like I was falling apart. And I started to look at other things I could do aside from antibiotics, given they were giving me additional issues. And I did coincidentally meet a doctor when I was living in Berlin who agreed with me that stepping away from antibiotics was probably the right choice, and that I probably had issues with candida and maybe there was a hormonal element. So I ended up stopping the hormonal birth control I was on. I did a lot of tests to look for vitamin deficiencies. I changed my diet completely, and then I started taking a supplement regime that included natural antimicrobials that were targeting the candida. And that's when it really started to turn around for me, when I stopped doing what I'd been doing for 5 years that hadn't been working.
And would you recommend that women talk to their doctors about possibly following a similar treatment plan?
I would say similar is not the right approach because the cause for every single person is different. So if
Of
the
course.
next person doesn't have a candida problem, what I did is likely not going to help, but it can help to talk
Right.
to your doctor about a longer term approach. And for me, once I changed to this approach, it took about 10 months until I felt free of
Wow.
my symptoms. I felt a lot better after just a week, but I kept on going with it because I was scared that it would come back. It's difficult when you don't want to stop what you're doing if it's working. And so it took me about that long to be confident enough to stop. But it really helped having a doctor that was kind of on my side with this, with taking a more long-term approach and guiding me on taking things in higher doses than what you would if you read the label. And that's also important. You shouldn't just be doing this on your own if you're taking a different level of doses or you're taking multiple things together, because even natural supplements can interact with each other or they can interact with your other medications. And you really need to get advice on that.
Totally. I actually had candida as well, and
Mm,
I was given turconazole gel, which is what you insert vaginally with the help of like a little
mhm,
syringe. And that seemed to help at first. And then for whatever the reason, it didn't. And I went through a period over like 5 months where I would think it would go away. Literally 2 days later, I would get
mhm.
symptoms again. Then I'd call my doctor. He'd give me something else. It would go away, and then it'd come back. And I finally had to say, you know what? This doctor has been great for the last 10 years for me, taking care of all of my OB/GYN needs, but he's not doing great for me now. So then I found a new doctor who, after seeing literally one time, figured out my yeast UTI combo issue.
Mhm.
And it took 2 weeks of twice a day boric acid suppositories to finally nip it in the butt, which is crazy that that's what did it. But what
Mhm.
it did was basically shock my pH system. I was getting these yeast infections like with the UTIs. I don't know what they have to do
It's
with it,
yeah, it's a
but
horrible combination. I've definitely been there. That's what I experienced for those 5 years, just the combination of both constantly, or if not
yeah.
at the same time, one then the other. So it's just discomfort 100% of the time.
A lot of women seem to be really shy about talking about this kind of thing. It's almost like we would rather say that we have like an autoimmune disease or like a stomach virus than saying we have a UTI. It's kind of sometimes embarrassing to admit. And sometimes I feel like society sometimes, I don't know, kind of makes us feel a little bad, like maybe it means that we're dirty. Is that a myth? Does having a UTI mean that you're dirty, that you don't have good hygiene?
It's definitely one of the myths that I wish would be busted. It's something that we hear a lot. Like people go to the doctor and they're just told that they're not wiping properly or that they're
Exactly.
not wearing the right types of clothes or that something they're doing is wrong. And that blame on the patient is just one of the worst things about this, I think, because it makes the patient feel like they are actually doing something wrong rather than they have an infection. You would never get told if you have a chronic sinus infection that you're not blowing your nose properly or that you're not taking the right precautions for your sinus. And that it just doesn't make sense to blame the patient. Most patients with UTI are so fastidious about their hygiene. I mean, sometimes it probably goes too far in the other direction, but they've learned how to wipe properly. They've learned how to do all the standard things they're supposed to do. So it's definitely a myth in most cases, though there's always exceptions to the rule.
Totally. And I think that the more that women know about UTIs, the better they can help themselves and try to prevent them. Melissa and I actually wrote a blog. You can find it in the details below. We wrote this kind of side by side, and we decided that it would be great to share our personal stories, but also I've kind of taken it upon myself to include a little bit of helpful info for you out there who are suffering from these horrific UTIs. So a lot of what we talked about in this interview is what I've included in the blog post. So check it out. Melissa did one that's totally unique from mine. So check out both of them. Hers is on liveutifree.com. Mine's on realgirlreview.com. And we'll leave that link below.
Yeah. I would love to know more about your journey. So I know that you were diagnosed with lupus at some point. I'm not sure how long ago that was and whether your experience with UTI started before that or after it. Can you give us some more insight around that?
Yeah, I'd love to. So actually, it's kind of funny. In December, I will be celebrating a decade of being diagnosed with lupus and getting treatment, which is pretty crazy when you think about how long your journey has been.
Mm-hmm.
It's taken me through so many ups and downs. It's like you get the diagnosis, that's an up, and then you start feeling so many symptoms, then you go back down, and then it's just about finding the balance and what works for you and getting the doctors that you feel you communicate best with and kind of having like an all-star, medical team, really. I have all of these specialists who work with each other to treat my lupus, and that's pretty awesome that I've been able to get care. A lot of women spend, and men for that matter, spend years trying to diagnose this.
Mm-hmm.
I was diagnosed after a very crazy incident at school. I was in art class in high school, and one day I was just sitting there minding my own business, working on my project. And then there's this kid from across the way who decided that it would be a great idea to make a paper airplane with a pencil attached to it and stick it right in my eye. He flew that thing and it landed right here. And it gave me a corneal abrasion, which went away.
Mm-hmm.
But what that did was make me see an eye specialist who looked in my eye and was like, I don't care about the corneal abrasion. I care about what's underneath there, because the eyes are kind of like the window into the rest of the body, which is crazy.
Mm-hmm.
She sent me to my primary care doctor with a script for a rheumatoid test. And then all of a sudden I was diagnosed with lupus. And I'm like, oh my gosh, the last few years, I've been trying to figure out what is wrong with me. Everyone keeps telling me I'm a dramatic teenager. And no one's getting to the bottom of it except for this one eye doctor who is treating my corneal abrasion from the eye accident. So crazy how things happen.
That's pretty phenomenal.
Yeah. I'm so lucky though. A lot of people, as I said, don't get the treatment that they need. But I really found that it's just about listening to your body. Don't let anyone tell you that you're not feeling what you are. You know your body better than anyone. And if a doctor doesn't agree with you, go to the next doctor. Luckily for you, there are so many doctors in this world. So to answer your question, UTIs and lupus. So UTIs are something that I would get a lot during my teens. It would kind of come and go, and I would only really know about them, not because I had any real symptoms, but because I get regular blood work to check up on my lupus like every 2 to 3 months. And I have to get a urinalysis as well. And so my doctor would be like, oh yeah, and by the way, you have a UTI. Here, I'm gonna write you a script. There you go, take care of it. Didn't have any issues. Knock on wood. Luckily, I didn't have any.
Yeah.
And then went into, my 20s. I'm 26 now, and I started, having boyfriends, being sexually active. And then I would get UTIs, and I had no idea why. And I didn't really even honestly know what a UTI was. Like one of those things that you Google, maybe you read like the first sentence, maybe 2 sentences, but you don't look much into it. You're just like, okay, well, they gave me medication. It's going to be over soon.
As long as the antibiotics work, you don't really care about it past that.
Exactly. You don't care. But then when they don't work after multiple rounds of treatment, that's when you're like, what is going on? How do I take care of this? And that's actually how I found your website, Melissa. I was so desperate at the point. I'm just like, nothing is working. I can't even tell you the amount of embarrassing stories. Maybe I'll share some to make our viewers feel better. I'll share one actually.
Okay.
I don't know if my boyfriend's around, but he remembers. It was at the beginning of the home renovation project, and we were basically sleeping on an air mattress on, the floor with sawdust everywhere. And I had a little fan in the corner of the room. I was experiencing this burning sensation. And when I say that it felt like my cookie was on fire, it felt like it was literally on fire. I don't know how to describe it. Maybe you've experienced it. And the only thing that worked in that moment was getting kind of in like a fetal position with my booty in the air, and the fan was on me blowing full blast. Nothing was working. None of the medication that the doctors gave me worked. And I'm sure that you've been through your own similar kind of
Similar. I never thought to use a fan, but I've definitely had similar experiences.
Do you want to share one with us?
I'm trying. I mean, I don't think of any of mine as embarrassing, so it's hard to.
Yeah.
But I've definitely been in situations that I would prefer not to. And one of them was when I got on a flight from Berlin to Australia, which is obviously multiple flights. But in the first half, which is about 14 hours, at least from London to somewhere in Asia, probably Singapore, it was okay. I felt like I was starting to come through it. So I got back on the flight to Australia, which is about another 10 hours or so, but immediately started to feel that rising dread that you get with a UTI when you know what's getting worse and you maybe can't even put your finger on it. But I just knew it was a bad situation and I had to ask the person next to me whether I could switch seats with them because I needed to be in the aisle because I needed to use the bathroom. And I just told her that and she just said, fine. But I literally drank water and peed every 20 minutes nonstop because I was quite worried that it would escalate during that time and the antibiotics didn't work. I didn't have any more. And by the time I got to Sydney, where I had one more flight to go to get to Melbourne, I just was a mess and I had to ditch my next flight and find an airport doctor, put my bag in a locker, just go and hope for the best. This doctor gave me anti-nausea medication, antibiotics, everything that he could give me because he could see what a state I was in.
Are those the symptoms that you had? You were nauseous, you were...
I wasn't. He said to me, I'll give you anti-nausea medication. I was like, I don't need that. I've never used it before. And then about half an hour later, I felt so sick that I couldn't eat anything, but I hadn't eaten in hours. And so then I took the anti-nausea medication. So he could probably just predict it. But before that time, I'd never had that nausea symptom. But after being on a flight for 10 hours with no medication, and air travel also just does something to your body where it makes everything worse, I find. So the combination of all of that and then landing still not at home was a pretty terrible trip for me. And eventually when I did get to Melbourne, I just slept for like 30 hours because I was so destroyed on the journey.
Oh my gosh. That's horrific. And unfortunately, we're not the only ones who have this story. So many of our viewers have their own stories and Melissa and I would love to hear them. Leave them in the comments below if you want to share. But yeah, I remember when I was first starting to get these rapid like UTIs like back to back, and that was like right before I had reached out to you after finding your website off of a Google search. You know, that's how it starts, a Google search. And I was in a new relationship with my boyfriend. We had only been going out for like a month maybe, and I was too embarrassed to tell him. I was at his place. And I literally could not even sit down because if I sat down, then I would feel the burning pain even more. So I was literally crouching down, just kind of like a frog and drinking, like literally I bought like 2 big jugs of cranberry chips. I don't know if that's a myth, but it kind of worked a little bit until, you know, it would come back again, obviously. But yeah, I mean, we tried desperately to find all these different things, you know, just to have answers. And unfortunately, it's not just like one and done, you know, like there are like a million different paths you could take depending on the individual. There's not one set cure. That's what makes it so frustrating.
Do you remember how you ended up telling your boyfriend about the situation?
Yeah, I had to because I had him take me to the emergency room that night. It was getting to the point where I couldn't do anything. I couldn't stand, I couldn't sit. I went into the bathroom and I was just crying, just talking to my mom, who's my best friend. And I'm just like, I can't do this anymore. And then she's like, tell your boyfriend, you know, you need him to take you to the doctors. And I'm like, I can't, I'm mortified. This is like a new relationship. This is when you're trying to still be like all cute and like, you know, perfect. And it's like, no. So I had to tell him. That was very embarrassing for me, but don't be embarrassed. You know, girls go through this. I was also embarrassed to tell him because I was afraid that he would think the same thing that a lot of other people think, that meant that I was dirty. And I take like sometimes 2 to 3 showers a day. I know that may not be, you know, the best thing, but I just need to be clean all the time. So it's not true that if you have a UTI, you don't have good hygiene.
Definitely not.
Yeah, I wish other people would stop saying that and make us, you know, feel bad.
Yeah, I just let that roll off me now. I mean, I don't think anyone's actually said that to me in a long time, but I'm not even sure if any doctor ever did say that to me, but I hear it from so many other people that I already feel anger about it. So a
Yeah.
couple of people asked if we ever found out what bacteria was causing our UTIs. Did you ever get a positive test and feel like it was accurate?
Um, so I would get some tests that would say I had, I think, E. coli,
Mhm.
which seems to be the common one, and then some tests that would say another one. And depending on which bacteria you have, depends on which antibiotic they end up treating you with. So most of the time I was diagnosed with E. coli, so I would take the macrobid. I don't know if it's called something different in other parts of the
Yeah.
world, but that none of the antibiotics ended up helping. So the only thing that ended up helping, knock on wood, I don't want to now jinx it for myself, but the boric acid suppositories, it just shocked my system. But I
So
also,
that's actually helped with your UTIs as well as the yeast infection.
oh yeah, because what my
Great.
doctor told me is that sometimes I think she said the UTIs can cause the yeast infections. So if I didn't have I think I was taking the Borg suppositories for the yeast infection, I want to say. But sometimes she said they can cause each other. The UTI can cause the yeast and the yeast can cause the UTI. So taking care of one, took care of the other for me. That's, maybe not the case for everyone, but that's what ended up helping me.
Yeah, I also found the same thing after that 5 years. One of the main things I did was try to address the vaginal microbiome. And there is research to show that the two microbiomes are connected. They don't know exactly how, but a lot of the same organisms appear in the bladder and in the vagina. So there's clearly something going on there, which means if one is off, the other might be off. And that kind of opens up a good area for future research and possible treatment options, I think.
I think that, and that's why your site is so great. And when I found it, I was like, amazing. Because it's so professional. You seem to really take the time to work with all of these different medical specialists and really try hard to research the right things to give us the right information. But one thing that I really loved about liveUTIfree.com is that you actually give people the opportunity to take a test, like a cute little quiz. You're just doing answers that work for you, and then at the very end you get kind of like an answer that you can start with to find the treatment plan for you.
It's true. I think one of the things, and this is why we built the quiz in the first place, because when I was going through this problem, I just felt like I didn't know where to turn. I didn't feel like people understood me. So we wanted to build a quiz where the questions themselves let people know that we understood their experience. But at the end, when we had the information we needed, we could point them towards articles that might be most helpful for what they told us. And then we also send them other resources, like a list of products that our community have found helpful, and also the opportunity to reach out to us if they'd like to find a chronic UTI specialist. So we try to make it as well-rounded as possible without telling anybody that there's any one way to do this, because every single person will find a different thing that works for them. And there is no silver bullet for this. And for some people, antibiotics are crucial. And for other people, it's not the answer. So we just want to give people information so they can make their own decisions.
I love that about your site, that you acknowledge that there is not one set cure for the UTI, that there are many different paths that you could take to treat your UTI. Thank you for creating such a great site that has been resourceful to me and so many other people who are so desperate for answers when it comes to their situation.
That's really good to hear. And I did want to say, a lot of people ask if it is possible to get better. And that's one thing that I have seen through our site, is that it's definitely possible, but it will be different for everybody. We have heard from a lot of people who have been members of our community for some time and reach out to say that they're better now. And sometimes they write to me to tell me they're unsubscribing from the newsletter because they're better, but they wanted to tell me before they did it, which is really sweet. But it's also
Aww.
what we hope for. We hope that every time someone unsubscribes, it's because they're well or they found an answer. We don't want people to keep coming back. We want them to find a solution. And there are a lot of people that reach out to tell us the different ways they have done that. And it's not always the same. It's not always antibiotics. Sometimes it's hormonal, or sometimes it's diet, and sometimes it's pelvic floor. There's
Right.
so many different things that could be contributing to this problem. And that has become so clear through the conversations we've had with our community.
Maybe there's a place that you can send them, like, the UTI recovery crew or something. It's like, go have fun now. Here are blogs about like where to travel and all
Yeah,
the
I
fun.
think that's just like everything else. It's part of the problem is when people do get better, they leave the groups and they leave the community. And I can completely understand that. Why would you want to keep talking about it? But it does give you the feeling that people don't get well because the only people you're hearing from are the people that are still battling the problem. But there are plenty of people that kind of graduate from the groups and don't look back. And it's important to have that knowledge that there is hope, and maybe the next thing you try will be the thing that works for you, or maybe it won't, but you really need to persevere. And like you said, keep trying to find a doctor that is willing to work with you in the way that you want to.
Exactly.
Thank you for tuning in to our special interview. We loved answering your questions and getting to know each other a bit more. For more information on chronic conditions, fun travel adventures, and all that jazz, follow us on social media and at our blogs. If you like this video, give it a thumbs up and leave us a comment down below. See you next time.